Now as I say this to you all, I have a very high pain tolerance, so for me to say it is really bad it was. Mum knew it was sore because I was nearly crying every time I had to move. It would then just disappear and I would not have any pain for a while. A number of years ago, my left shoulder started to be a little painful. It would go after a few days. If I was really bad with it, it would stay for longer, and it could be really sore enough so I would not be able to lift my arm above my head sometimes. And I would forget about it. We saw a doctor not long after one of my flare-ups, so we explained to him what it felt like. He said, from what you are all saying, it sounds like calcification. Then we just left it wrong, alright, but we did, so can't go back. We were just treating it as he said, calcification, but he didn't send me for any X-rays or anything like that at the time because we didn't stay with his service as he was in a different area, which means we would have had to change everything over, so we saw a different doctor. It had not been that bad for a while, so I had just forgotten about it again. Just recently it has not been as bad as it normally would have been, but it has been there. Mum said we shouldn't be ignoring this anymore as it is happening more frequently now than it was before, so I said fine, make me a phone consultation to the doctors then and we will see what they say. So Mum was explaining, as she is better with the GPs on the phone than I am, what was happening, and they said, I'll tell you what, we'll send you for a scan. This was a couple of months after trying for ages to make an appointment. We finally got one to go and see them to do the scan. So we went and she did it and she told us there and then it wasn't calcification, or she couldn't see calcification at this time, although there is a lot of fluid around your shoulder joint and your tendon is very inflamed, which is called tendinitis, and bursitis. They are both very painful things to have. You don't normally see them together, but I have to be greedy. The lady said, no wonder you are in pain because the bursitis on its own hurts, but I can just imagine with the tendinitis it will hurt more. Then we said to the lady doing the scan, is there anything we could do to make it easier while we wait for a doctor's appointment to see what they are going to do with the findings? Then of course Mum looked online to see what type of things there was to do, although we weren't going to do them, she just wanted to see. Finally got round to getting a doctor's appointment again to discuss the findings of the scan, because at first they said they wanted to leave me for another 2 weeks, and by this point it was painful again, so Mum said okay, because what else was she supposed to do? And then somebody realised what I had and how much pain I would be in with it and rang us before the 2 weeks had even ended. She said, you have definitely got tendinitis and bursitis in your shoulder. Also you have a bit of arthritis, literally a tiny little bit, so not enough that they would give me anything for it. But then we got onto medication for the bursitis and tendinitis. She said all you can really do is have anti-inflammatories and pain relief. There is an injection you can have called cortisone, but as I'm scared of needles and injections I didn't fancy that. Other than that, that's all we can offer you. I declined the cortisone injection only on the basis of I will not be able to stay still, because she explained to Mum, and then Mum explained to me what they would do to do, which is stick a big needle in your shoulder whilst also having a scan, so they can actually see where the needle needs to be, so they are expecting me to stay still. Now if you know me very well, you know this will not happen in a month of Sundays. When I get a flare-up, I have medication I can take and it will reduce it a lot more. I don't have as much problems at the moment with it, touch wood. It's sore when I'm in bed, but not when I'm out and about and in my chair. I can still move my arm properly again now, so hopefully it won't come back for a while. They did say that it would clear up on its own. I said, how could I have got this problem in the first place? And they said it could just be a coincidence, or it could be you've injured your shoulder but never noticed, and now that's what it's caused by. Because they also said to me, how long have you had it? And I said absolutely ages. So they said there's no use in giving you antibiotics in case it's an infection, because you have had it too long for the antibiotics to have an effect.